Healthcare for Latinos in the U.S. Some demographics of the Hispanic population in the United States. Hispanics currently make up 70% of the total population. Hispanics have the longest life expectancy in the U.S., and there is a Hispanic paradox in which Hispanics have a longer life expectancy and a lower overall mortality, despite potential barriers to good health such as high rates of being uninsured and low socioeconomic standing. Latinos on average are younger and have larger families than other demographic groups, often in lower income brackets, and therefore utilizing services in different ways such as prevention and management of chronic conditions and maternal and child health services will be in higher demand for Latinos. Mexicans and Mexican Americans comprise the largest subgroup of Latinos in the U.S., followed by Puerto Ricans, Salvadorians, Cubans, Dominicans, and Guatemalans. The National Latino Health and Immigration Survey found in March 2015 said that only 70% of legal Latinos lack health insurance. An estimate suggests that one-third of Latinos and Hispanics have had no previous access to health care services. Health risks in Hispanics influenced by nationality and the place of birth. Health risks can vary from the Hispanic population in comparison to the major U.S. Caucasian population, as well as there is an intervariation between the different subgroups of Hispanics themselves, and whether Hispanics were born in the U.S. or in a Spanish-speaking country makes a difference as well. For example, being born in the U.S. and increasing length of stay in the U.S. is associated with risk factors of poor health outcomes. Hispanics have more poorly controlled high blood pressure. Hispanics have a higher percentage of obesity. Hispanics have a higher percentage of less colorectal screenings. Puerto Rican and Cuban males have the highest rate of smoking overall the Hispanics. Hispanic women with high blood pressure are twice as likely as Hispanic men to get it under control. Hispanics have a higher risk of dying from intentional injuries than non-Hispanic whites, and U.S.-born Hispanics are more likely to contract cancer and heart disease, obesity, and have a habit of smoking than foreign-born Hispanics. Some issues that affect Hispanic healthcare in the U.S. and their solutions. Some issues could be the language barriers and the lack of medical interpreters in the U.S. healthcare system, as well as the presence of unprepared, biased, or unprofessional interpreters that have been known to scare Hispanics from seeking medical aid in the U.S., which can cause many patients who need interpreters do not have access to them, which no interpreters were used in almost half of emergency department cases involving non-proficient English-speaking patients, and only a few U.S. teaching hospitals provide any interpreter training, and if they do, they will make it optional. Patients that face language barriers receive preventive services at reduced rates and have an increased risk of medical non-adherence. Patients with these barriers and psychosomatic conditions are more likely to be diagnosed with a severe psychopathology and are more likely to leave the hospital against medical advice. Solutions to this problem could be the implementation of bilingual health education materials and residency programs, increased Spanish-speaking and bilingual healthcare providers in clinics and hospitals, the construction of patient-centered medical homes that provide team-based comprehensive coordinated healthcare with enhanced access, personalized healthcare not differentiated by ethical subgroups but by everyone, a much more personal manner of treating a Hispanic patient. Another issue could be that there is a lack of health estimates certified by Hispanic origin and nationality. There's a lack of representation of Hispanics in the healthcare and public health workforce, and the absence of affordable insurance coverages to Hispanics in the U.S. to have access to preventive care. And despite efforts to advance clinical trial diversity, most trials remain representative of non-Hispanic white populations. Some solutions to this could be the federal government can help eligible Hispanics get insurance coverage, leverage existing programs to improve access to preventive care, and make efforts to better represent all Hispanics in national health data and research studies, and the use of such data to improve Hispanic health overall. Another issue is that public health programs aren't culturally appropriate nor tolerant towards the diverse customs, beliefs, and cultural behaviors of certain Hispanics. Miscommunication and misinterpretation can lead to catastrophes that not only affect the healthcare provider and the place they work, but can also affect the health of the patient in question. Healthcare providers lack acknowledgement and respect of Hispanic religious beliefs and activities. Due to cultural differences, there are some topics that many Hispanics have difficulty speaking about, such as sexuality, family planning, domestic abuse, and the use of recreational drugs. Some solutions to this could be the staff training and techniques for building rapport can foster better communication, increase empathy and compassion, and lead to the establishment of trusting relationships in which disclosure is more likely. Inquiring about clients' religious beliefs and needs can have a substantial clinical benefit, such as an increased understanding of the client's perceptions of the causation of disease and the modification of delivery of relevant healthcare teaching, a rapport with clients, and increased support of the religious needs of clients. Having healthcare providers use culturally sensitive therapeutic communication techniques in an active manner of speaking, having healthcare providers be aware of their body language and attentive to their clients' mannerisms of praying or exhibiting religious practices, and keep patients comfortable in an environment that expresses their religious beliefs. Some ways of improving interpreter etiquette and efficacy could be you need to make everyone aware, even the front desk, patient, family, and clinical staff, that you are the interpreter. When you introduce yourself to the doctor, make sure to ask if he or she has worked with an interpreter before to ease interpretation. You shouldn't be afraid to be alone with the patient, and small talk is not required nor forbidden and should not compromise your neutrality. You need to use a consecutive translation for nurse's patient initial intake questions and for the patient's answers too. And you can use a simultaneous translation when the patient is giving more detail to the clinician or describing the precursor for the reason of their visit. Find a position for the interpretation where you can hear everyone and you can be heard by everyone as well. Have the nurse go over the instructions with you first and then sight translate them to the patient. Always be prepared to take notes, even though you have to be professional and firm. It is important to still have a friendly demeanor. And the use of region-specific interpreters, matching the client with an interpreter based on age and gender, and allow for each one to become acquainted with one another. Some U.S. states have been trying to address these issues in the health systems for Hispanics. For example, as Maryland, which they did the Personalized Medicine and Hispanic Health Contributions to Reducing Health Disparities workshop in conjunction with the National Heart, Lung, and Blood Institute, the National Institute of Diabetes and the Digestive and Kidney Disease, the Food and Drug Administration, and the National Institutes of Health. Open to the public and was videocast live in 2016 with invited medical and social science professionals, public and health policy experts, geneticists, epidemiologists, clinical investigators, and patient advocates to participate as speakers and panelists. Identify gaps in evidence of efficacy, effectiveness, and safety of therapies for heart, lung, blood, and sleep disorders and conditions and their risk factors, accounting for the racial, ethnic, and socioeconomic diversity among Hispanic Latinos. Another objective was to describe potential approaches to studying medical treatments and health outcomes among Hispanics, Latinos, and garner the necessary evidence to fill these gaps. Another one objective that they had was to define research opportunities related to personalized medicine to improve knowledge and develop effective interventions to reduce health disparities among Hispanic Latinos in the U.S. Another state that's been trying to address these issues is New York, in which they founded the Community Voices Project, sponsored by the W.K. Kellogg Foundation, that's worked in the Washington Heights area of northern Manhattan, home to a large number of immigrants from the Dominican Republic, and the rest of northern Manhattan to expand low-income resident access to health services with a focus on oral health, diabetes prevention, asthma, and men's health. In the area of men's health, the attention is given to the need for employment strategies that lead to better jobs and strengthen families, including adequate pay and health care coverage, but also enhance self-esteem and increase opportunities that could lead to improved health outcomes and disease prevention. Improving provider continuity, establishing asthma screening in daycare centers, and providing outreach to Spanish monolingual families and families limited to care through emergency rooms. Regarding diabetes prevention and treatment, a holistic approach is used that includes culturally appropriate outreach and a focus on diet, nutrition, and fitness within the context of neighborhood conditions. Another state that has been trying to address these issues is Kansas, in which they did a proposal for improving Latino health equity through Spanish language interpreter advocacy, in which the proposal proposed to standardized training for interpreters should be acquired, and that this training should address the code of ethics for medical interpreters, cultural competency, and medical terms and phrases. Healthcare interpreting should be viewed as a specialization and full-time career, and medical interpreters should be positioned as a patient advocates and part of the healthcare team. At the university level in Kansas, it's recommended to create certificate programs in cultural healthcare, communication, and interprofessional training opportunities that allow students in the fields of translation, interpretation, and students in health professions to work together. Healthcare facilities should not accept ad hoc interpreters. In order to make this possible, on-site interpreters or tablet remote interpreting should be easily accessible at all times. Facilities should have on-site interpreters who are socialized into being part of the healthcare team, and healthcare providers should be socialized into including those interpreters in the team. States should reimburse healthcare facilities that provide interpreters to improve the health outcomes for this population throughout the state of Kansas and as a model to other Midwestern states. Some conclusions to this research that I've conducted was that health risk differs between Hispanics of different nationalities and places of birth, which ultimately affects the route of intervention and care of these Hispanics. Language barriers, miscommunication, misinterpretation, and a lack of medical interpreters present in the medical system affect the overall recovery of Hispanic and U.S. population, and they are scared to seek medical aid. A lack of representation of the Hispanic population in medical and clinical research and studies have a detrimental effect on the preventive care offered to Hispanics. Cultural intolerance and differences can lead to sensitive patient-doctor relationships that influence the accuracy of a diagnosis and treatment. U.S. states must start improving the healthcare system by providing information throughout the medical conferences that are open to the public, projects that are based in Hispanic communities, and proposals to, in some way, improve medical interpretation in the U.S. healthcare system. And these are my references, and thank you very much.